Good morning. Looks like we have participants who are starting to roll in the door. Welcome. We're going to give it about another minute and then we'll go ahead and get started. Okay, well, let's go ahead and get started. I am Shannon Decker. I am hosting today's webinar, Isolation in the Time of COVID-19. I wear two hats currently, and most days I wear two hats. Suicide Prevention Coordinator for Sierra Community House, as well as the Executive Director and co-founder of the Speedy Foundation. So I am based in Truckee, California, and the Speedy Foundation does a lot of work in the states of Idaho and Utah. So I'm traveling back there often. You can contact me at either email address. Today we're going to just kind of talk about isolation and a lot of potential issues that have arisen due to COVID-19, as well as some of the areas where we can have a big impact in helping with protective factors to help support people during this time. And just some of the basics, some of the nuts and bolts, keeping our distance to help stop the spread. We're doing this social experiment to help flatten the curve. Social distancing. Maybe we should have been calling this physical distancing, really keeping space between ourselves and others. 6 feet, not gathering in groups, staying out of crowded places. When I first put this presentation together, it was about a month ago, and so a lot of states were still in lockdown mode. And taking steps as a society to slow the spread of the virus, to keep our emergency rooms from overcrowding. So that's the why. That's the why we're in this situation, just the basics. And what's the difference? What's the difference between social distancing, quarantine, and social isolation? Really what we need to be focused on here is how are we connecting with other people, because all of these different pieces, isolation, quarantine, are impacted by what's going on with our health. The focus of us here today is how are we connecting with other people? An exercise I would like for us to think about for just a moment is thinking back to life before middle of March 2020. We used to run into people. We used to run into people at the grocery store on kind of a regular basis. We used to run into maybe the custodian at a school, and we would have a pleasantry. We would have a relationship. We would say hello. We would ask about family. We haven't seen these people for about 2 months. Are there people in your life that you used to come into contact with outside of the people who you're quarantining with, outside of the people that maybe you've got a quarantine bubble with in your neighborhood or your Zoom calls? Who are those people that you used to have contact with? And is there any way to have contact with them now? Could you write a postcard to the baristas? Those moments of connection are really profound to the human condition. So really quickly, in the chat feature, it looks like we've only got a couple people on the line, but I was hoping that we could do a quick brainstorm. If you want to open the chat feature, what are some of the feelings that people might be feeling right now? Or maybe they're the feelings that you've felt. And we might not have enough people to participate in this manner, which is okay. Depression, loneliness, frustration, anxiety. Absolutely. Absolutely. Um, everything that you guys have listed, sadness, are things that, I've personally experienced in the past 2 months. And these are common feelings, whether they're clinically diagnosable as a condition or not. So thank you for submitting that. Let's take a look. People might be feeling anxiety, worry, fear related to their own health status, or perhaps the health status of others who they might be exposed to the disease. They might have resentment from friends or family. They might feel that they need to go into quarantine as a result of contact with you. Um, the monitoring yourself or being monitored by others for symptoms of disease. These are kind of new conditions that we haven't experienced at a broad society. Somebody with cancer might have somebody who is monitoring their health condition, or somebody with a chronic illness. But as a society, we weren't necessarily fearful of the conditions, the health conditions of others. We might have to take time off of work, and there's fear of a potential loss of income or job security. Or at this point, it could be a very real situation that people are facing. The challenges of securing all the things that they need. In the beginning, we were hoarding toilet paper. We were hoarding all kinds of groceries. I know that a little bag, a little quart-sized bag of flour at our little local market was $11. Flour became a huge commodity. They might also have concern about effectively caring for children or others, the uncertainty or frustration of how long this might remain, loneliness associated with those feelings of just being cut off from their loved ones and the outside world. Anger, if you feel like you've been exposed due to other people's negligence. I see that a lot on social media right now, people that are upset about others not wearing masks or being forced to wear a mask. There's a lot of anger out there on social media. There's boredom, there's frustration, uncertainty, ambivalence, a desire to use alcohol or drugs to help cope, symptoms of depression, things that you guys listed earlier, symptoms of post-traumatic stress disorder, that intrinsic, distressing memories, flashbacks, nightmares. It could be triggering some past trauma. So how does loneliness affect our health? Really feeling like you have no one you can talk to. It affects most people at some point in association with poor physical or mental well-being. Thinking about loneliness, there's studies that say, loneliness can have as big of an impact as smoking does on one's health. And there's plenty of research to suggest that our social relationships can be just as important as our physical health. So who is most at risk? Again, we don't have a lot of people on the chat, but there's a lot of people that come to mind. I was going to have you guys throw some ideas out there, but we do have the elderly, especially those who are in nursing homes, who are completely isolated, are at risk for isolation and all of those feelings that we just went through. Youth, if we think about all the things that youth are going through, they've been cut off from their peers, they're missing, their regular routine, their job to go to school, graduation rituals, just relationships. A lot of young people, in their preteen and teen years, are starting to have their first relationships, and those have been cut off. Single people might be completely isolated if they are working from home and they don't have contact with the outside world. I mean, the grocery store might be someplace where they're coming into contact with others. The idea that perhaps they haven't had a hug. Maybe they haven't hugged another person in 2 months. We know that that physical touch, having 10 hugs a day, can be profound on somebody's physical health. Again, those who are prone to COVID illnesses or prone to loneliness prior to COVID, and there's a lot of others. I am going to have a couple little videos, and hopefully this helps support the work that we are already doing and the knowledge that we already have.
Following the global outbreak of the novel coronavirus COVID-19, social distancing has become a necessary preventative measure to slow the spread of this easily transmitted virus. Millions of people are quarantined, causing many to feel suddenly very isolated and alone. Even during normal circumstances, prolonged isolation can be harmful. It has been linked to heart disease, depression, dementia, and even impaired immunity. Social isolation can also exaggerate pre-existing symptoms like anxiety, depression, and even panic. So what can you do to stay connected and healthy while practicing social distancing? First, take care of your mental, physical, and psychological well-being. While it's important to stay up to date on what's going on around you, remember to also focus on the positive. If you have negative thoughts or worries, don't ignore them. Instead, try acknowledging and accepting them, and then discuss them with someone you trust. Breathing exercises, mindfulness, meditation, and muscle relaxation can also help your mental, physical, and emotional state. Exercise. Exercise is another great way to take care of your physical and mental health while in social isolation. Even though you may not be able to go to the gym, find ways to take walks, stretch, and stay active within your space. Find alternative ways to connect with others. There are many ways to connect with your family, friends, and others using technologies such as video chat, text, email, calling, or the various social media platforms. Participating in safe and appropriate social media challenges can also be a fun way to help you feel connected. Interacting with people using online support groups can provide great opportunities for you to not only talk about how you are feeling, but also offer emotional support to others who need help coping with the pandemic. Stay active. Long periods of physical and mental inactivity can lead to depression and poor health. Find a project you can do around the house or create a routine of activities to look forward to each day. Limit screen time. Watching TV, browsing the internet, and playing video games can be great outlets, but too much screen time is not healthy. Manage your electronics usage and consider setting reasonable limits each day. If your work from home involves using a computer or phone, try to get up and look away from your screen periodically. Be mindful of unhealthy coping strategies. During times of stress and even boredom, it's easy to cope by turning to food and alcohol. Keep in mind that overeating or drinking too much can lead to unhealthy and harmful habits. If you find yourself turning to food and drink to cope, try using other strategies like meditation, taking a walk, or calling a friend. Find the good. Believe it or not, there can actually be benefits to staying home. For instance, if you find yourself with more time on your hands, it can give you an opportunity to begin new projects, achieve some of your outstanding goals, or even get some much needed rest and sleep. If you are staying home with children or other family members, it can be an opportunity to spend more quality time together. Try to stay active, healthy, and connected with others during this trying time. Quarantine doesn't have to be unbearable if you remember to take care of yourself and others during your time at home.
All right. So definitely on the up and up, looking at the silver lining on that, but making sure that we are really focused. It's mindfulness. It's practicing that positive self-talk, because we know that being stranded at home or stuck at home with family members, with children, there's pros and cons to that. So with my focus has always been on suicide prevention. And we know that historically, following a pandemic, there has been a huge spike in suicidality. And so I always like to go back to Dr. Joyner's theory of suicide. A person becomes suicidal when they have the thwarted belongingness and they have that perceived burdensomeness. That's really what creates that desire for suicide. And people who, have live with suicidal ideation talk about how they can live in that state for quite a long time. It's not until that capacity for suicide is built that they're no longer afraid to die, or they have access to lethal means, and that is when we have that suicide, or a near lethal suicide attempt. And so experts are looking at this. There's articles that are coming out constantly. I think that, let's see, in the chat, Dawn has shared an article, and I'll have to take a look at that. But I know that there was one that just came out recently, and I'll send this in the follow-up, talking about, we don't know, but we know that historically this has happened. We have had higher suicide rates, and there's a lot of risk factors that contribute to that. Suicide is always very complex, but we do know that we can do preventative work. We can start to address the risk factors that are impacting this. And so there is an article that came out in, I want to say this was in March, from Dr. Joyner and a few others on the suicide mortality and coronavirus disease. Is this the perfect storm? There has been studies of SARS and other, pandemics, but they didn't really impact the world at such a high rate. And so it's really hard to make models for predicting. Social distancing. So social distancing may increase the risk. So to summarize the article that we just looked at, what it's saying is that we've got these additional risk factors. We've got economic stress, we have social isolation, decreased access to community and religious support. There's a lot of communities where religious support is mental health. That's the stigma of seeking medical support for mental health is just a barrier. And so that religious support can also be missing at this time. There's barriers to mental health treatment, illness and medical problems, in addition to what's taking place. There's national anxiety, and there's also been a huge increase in firearm sales. And so to counteract those risk factors, there are some prevention strategies with the ongoing pandemic. Emphasizing physical distancing, not social distancing. Thinking back to a barista that we used to see on Tuesday when we would splurge and stop by your local coffee shop. You can still have that interaction. I mean, at this point, we can go back in now in most places with masks on, but communication and just letting people know that you see them, that you miss them. I had a coworker that I worked with about 4 years ago in Santa Cruz send me a postcard, and it was so touching, and it spurred a reconnection. Increase access to mental health care, distance-based suicide prevention, and suicide prevention resources, as well as telemedicine. Really looking at telemedicine as something that we thought about. It was on the horizon. There were all kinds of barriers to establishing it, but many states, even rural states with very little infrastructure, have been able to stand up telemedicine. Governors were putting in executive orders to allow for exceptions, and that has helped folks access. I know the state of Colorado has created access for youth under 18 to have free access to mental health care telemedicine services. And there's ingenuity that's taking place to help support. This is an article I can send to you guys, but it's really looking at physicians' suicide risk and how much higher it is as is, but with the current pandemic, it also goes into the data. During the SARS outbreak of 2003, Hong Kong saw an increase in suicide among those over 65. And so it can show you some of the data and what we're looking at. But just to surmise, on a flight, you're reminded by the flight attendant to put on your own mask before you assist someone else. The logic being, if you're incapacitated, then you're unable to help those who cannot help themselves. In the COVID-19 epidemic, physicians are being asked to step up to help others. Doctors are precious, limited resource. We must first ensure our oxygen masks are on before we can help patients. Now more than ever, we have to break through the stigma among doctors and reach out to those around us. Take a moment and ask, are you okay? That simple gesture might save a life, who in turn can save thousands more. So there was a suicide prevention webinar that was held, and Dr. Cornell at the University of Rochester Medical Center said really the risk we can summarize into the 4Ds: depression, disablement or disability, disconnected, and deadly means. That spike in firearm sales is a huge indicator that there's fear, and that these firearms could be in homes where they're not safely being set up. When it comes to lethal means, there is a training called CALM, Counseling on Access to Lethal Means. The state of Utah has a free one with CEUs that are available. I'm able to provide them. I always include the CALM training when I'm doing like a QPR training, question, persuade, refer. Looking at those deadly means, looking at campaigns like Lock, Limit, Remove or Safer Homes, and making sure that folks within your sphere are aware of what could possibly be deadly means if someone were in crisis. The 4Ds, thinking about that. If this list triggers a flag and you think, man, this really resonates with my neighbor Bob or my cousin Stan, it's worth a conversation. Could they be suffering with depression, some type of disability, feeling disconnected, or have access to deadly means? Let's have a conversation with them. And to counter that, there's components of connectedness. So what can we do? Fighting loneliness, we can do a couple of things. We can recognize loneliness by naming something that I'm sure that you've all read Harry Potter. You know, to be able to name something is to take a lot of the power away from it, and it's to empower yourself. Practicing being vulnerable is huge. And there's lots of self-help out there on how to practice being vulnerable. But being genuine and vulnerable about your feelings helps create connection. And then, of course, being part of something bigger than yourself. So we're going to take a quick little video break on the 3 components of connectedness. And there might be an advertisement.
So Lit Mobile just sent me this solar wireless battery pack. I'm excited. Let's see what's inside.
We learned in our last video, your brain on social distancing, that we're not built to be alone, and that the longer we feel lonely, the more our bodies start to break down mentally, emotionally, and physically. Whether you're social distancing all by yourself or with a partner or family members, the COVID-19 pandemic has surely made your social interactions much fewer. Whatever your situation is, it's totally understandable to feel lonely. We feel it too. Here are 3 tactics to help you in the fight against loneliness. 1. Recognize your loneliness for what it is. Loneliness, like hunger or thirst, is a natural way for your body to tell you it needs something. Connection. You are not sensitive or weak. You're a human, a social creature. So take your feelings of loneliness seriously and objectively, just like you would for feelings of hunger or thirst. 2. Be vulnerable with at least one person. Pick someone who you can confide in and who can confide in you. Connect regularly via video calls or over the phone. It can be scary to talk about your feelings, but you'll both find that it's a great remedy for loneliness. 3. Be part of something bigger than yourself. Participating in greater society is critical for feeling connected. Thanks to technology, you can connect to something bigger without leaving your home. Consider finding a cause or nonprofit to follow and support. Lastly, we want you to know that you're not alone in your loneliness. In fact, this is one of the rare times in history that people all around the world, of all different cultures, languages, socioeconomic groups, are experiencing the same thing together. We have more great videos coming your way, so be sure to click subscribe. For more content and resources.
All right. There are a lot of really good videos. So if you do have a platform where you can share content. There's some really good resources. The Truckee Tahoe Suicide Prevention Coalition has a YouTube page, and I have a whole playlist of COVID-19 videos that I found to be pretty beneficial. On that Tahoe Lifeline website, there's also some COVID-19 resources, and we'll take a look at that in just a minute. But there's two podcasts, both with our past Surgeon General, Dr. Murthy, who has a new book that couldn't have had better timing. And so if you're a podcast connoisseur, there's two, one on hidden brain and one from Brene Brown, that are really profound. So if this is a topic that you're interested in, I suggest, taking a walk and listening to these two podcasts that are linked to that website. The bright side. For so long, loneliness has really been stigmatized. We didn't talk about, I'm at home and I feel lonely. We might talk about the physical symptoms that we were experiencing, but it was hard to name that feeling. I'm feeling isolated. I'm feeling lonely. I don't feel connected. And COVID-19 has leveled that. We now can talk about it. That stigma really has been smashed. And in mainstream media, we're talking about isolation and loneliness and the impact that it has. That's one of the bright sides here. So like I said, we are going to take a look at some resources. So with the Tahoe Lifeline, we've got some good resources, some current resources for postvention following a suicide, resources for COVID-19, and then for safety planning. So if you do have someone who is struggling with suicidality, there's a lot of resources for keeping them safe. On the Speedy Foundation's website, I've got a great page on storytelling, because if we're connecting, if we're sharing our story, there's safe ways of doing it so that we are a lighthouse and we are in place and we are pointing people towards safety. We're not getting into the water with them. And there's also some really good recommendations on media. So I will pull those up and kind of show you what those look like. Postvention resources, again, after losing someone to suicide, there's a lot of resources out there. But this is a time where it really, loss due to suicide is not necessarily a casserole disease. We don't show up the same way we do for folks who have lost someone in a different means. I've got a lot of information here on the coalition's website on postvention support as well. This is the one where I've been compiling. I have not had a chance to share these to the Speedy Foundation's website. So right now I'm just kind of bouncing back and forth. So we have some local Truckee, California resources and then national resources. So each one of these, is a very robust organization. Many are connected to suicide or mental health, and it's linking to their COVID-19 resources. There are some great resources for parents. Psych Hub is the one where we've had a couple videos from today. We've got books and articles, some PDFs. Again, we've got Dr. Joyner's article. But grieving a loss, any loss during COVID-19 is different. Grieving a suicide loss is different. And so there are some specific postvention responses and loss and isolation down here, as well as some great children's books talking to your children about COVID-19, some local resources. The VA came out with a really nice app for mental health, managing that, called the COVID Coach. So it was created by the VA, but it's open to anyone, targeted at anyone. There's our podcasts, additional videos. And this is a really nice helpline navigator to help you figure out, what it is exactly that you're looking for. What state are you looking at for? How do you want to filter this? Are you looking for a warm line to talk to somebody about bullying or eating disorders, to help you kind of suss that out? With the Speedy Foundation, there are a lot of different resources, but having conversations is part of our mission. And I'm going to send links so that we don't have to walk through through these websites. Let's switch back here. comment. Um, the takeaways. So some of the key takeaways from our work today. Those 4Ds. Again, if this catches your attention, depression, disablement, disconnection, deadly means, let's reach out. Stigma, or another term for stigma is discrimination. It limits that help seeking and help giving behavior. Let's recognize the stigma and help smash it. Telemedicine, again, due to COVID-19, this has been a game changer in access to care. And hopefully, if we are smart about this and we don't just go back to normal life, if we use this as a lesson and really start to improve things, we can stand up telemedicine and make parity and access to care. Safety planning, again, the Speedy Foundation and the Coalition both have great resources on safety planning and making that home environment comfortable and safe. There is an advocate in the state of Wyoming who always talks about there's locking your firearm, limiting access when you're struggling, or removing it from the home until things improve. But another thing that he suggests is, not everybody's willing to do that. If you can get them to store a firearm in a safe and to put a picture of family, loved ones, something that they care about, whatever connects them to life is a huge protective factor when it comes to that safety planning. And then those 3 components of connection: recognizing loneliness, being vulnerable, and then being part of something bigger than yourself. There's a new campaign that was launched from the Mental Health Coalition. And of course, the Speedy Foundation's mission is to start conversations to end the stigma. And so we really want to take the lead and have genuine conversations. This is the how are you really challenge? How are you really sharing this on your Instagram, your Facebook, or picking up the phone and having a very real conversation. The challenge is to nominate 5 friends. And so I'm going to nominate all of you to go forth and share the How Are You Really challenge. There are resources at their website, howareyourreally.org. And I do have an example. One of the beacons for me throughout all of this has been Governor Cuomo and the addresses that he's given to the state of New York. And so I'm going to share.
Hi, I'm Andrew Cuomo. I'd like to begin by thanking and applauding my brother-in-law, Kenneth Cole, and the Mental Health Coalition for putting the How Are You Really challenge together and asking individuals the powerful and poignant question of how they're really feeling, really, deep down inside. So how am I really feeling? Well, I'm sad for the number of New Yorkers who have died because of this awful virus. And I'm sad about the pain that so many families now feel. I'm frightened by this virus and frightened by what we don't know about this virus because the facts keep changing. And just when you have a sense of control, it seems the facts change again. I'm worried about my mother and her health. I'm sad for Michaela, my daughter, who will miss her college graduation. I'm concerned about the stress that New Yorkers are feeling and the increase in mental health issues, the anxiety issues, domestic violence, substance abuse. And I'm concerned that the damage being done is greater than we even now know. At the same time, I'm proud of how New Yorkers have rallied and come together, how so many New Yorkers are literally heroes rising to the challenge. I live by the rule that you will never solve a problem that you are unwilling to admit. The reality of mental health challenges in everyday life and the unique strain that we are now all living under are problems that we must finally admit and confront. The more openly we acknowledge our mental health crisis, the better we will all be and the healthier we will all be. I challenge all of my friends to answer the question, how are you doing, really?
All right. So, how am I really? It has been hard. I'm fine, but it has been hard. The Speedy Foundation had stacks of trainings live face-to-face, and it's taken years to build that up, to be able to train, various organizations. I had 3 different conferences lined up over the last 3 months. And all of the summer plans, all of the fundraising events that we had are on hold. I took on a new position with the Sierra Community House during this time. It's been hard to onboard in working remotely. I'm an extrovert and I feed off of connection with other people, which has been really difficult to just be interacting with a computer. I possibly had COVID myself and was not able to get testing. And so the anxiety of not knowing whether it was COVID or something greater was really, really hard. And it's been frustrating to try to get antibody testing. I think to be able to name something gives a lot of relief. And so that's hard. I found a lump in a breast, which has never happened before. And having to go through that has been, it's just taxing. Under any circumstance, that would be taxing. But during COVID, it's been hard. But on the flip side, I've been able to start ongoing Zoom happy hours with friends and connecting with people from all across the country in an ongoing way that we didn't have previously. It was usually a once a year get together. We quarantined with the neighbors, and they've been a huge support system. We've been able to share going to the grocery store and dinners. And when I was sick, there was checking in and there was bringing meals. And I'm hopeful that things are really starting to improve. I think that we did flatten the curve, and I'm grateful to be in Truckee writing this out. And so that's me. That's how I really am. And I challenge you all to go forward and share how you really are. Know the signs. So another thing that we can all do, if we think back to one of the summary of the article that Dr. Joyner wrote, is suicide prevention resources and training. We can do remote trainings. And so with the Speedy Foundation, we're working to realign our in-person trainings to be able to provide those digitally. Know the Signs is one that we've been able to digitize, and there are trainings that are coming up. So really quickly, let's take a look at what is Know the Signs. All right, and while we have this up on the screen, I would recommend, if it's not already in your phone, to program this phone number in right now. 1-800-273-TALK. 8255 is the Suicide Prevention Lifeline. So wherever you're at, when you call that phone number, it is going to link you to the call center associated with your area code. It might not be for you, and it might not be for now, but someday this number could help save a life. And we do have trainings that are coming up. Our next coffee talk on June 10th will be a Know the Signs training. The Truckee Tahoe Coalition has 3 trainings that are coming up. And this is a training that I'm able to provide. There's no cost. The campaign was developed by the state of California, but the resources don't necessarily need to point back to California resources. It's something that can be modified. And I'd be happy to help train organizations via Zoom if you're interested in scaling that training. So that is what I have for you guys today. We are coming in at 41 minutes, but I'm happy to answer any questions that you guys might have. And I did see that we've got a link to an article, A Woman Living Alone. We'll have to read that. If you guys have any other questions, I'm happy to answer them. Otherwise, we're going to end our coffee talk early today, and I hope to see you at another one in the future. All right. Well, it doesn't look like we have any questions right now. If you guys have any topics that you would like to see covered, feel free to reach out to me if you have any questions. And I will work to get this translated and uploaded and available to share. So again, thank you guys so much and have a great day. Don't forget to get out there and share your story of how are you really.